Okay, number one, you have to know your outcome. Number two, there is no substitute for having good coaches and mentors in your life. Number three, this is not sexy. Discipline and consistency. And the last thing that I like to tell people who are working hard and they're on the beginning part of their journey and they're trying to get better. Hi, I'm Dr. Jon Marashi, and I'm a cosmetic dentist in Los Angeles, California. Here's what I think sets a great clinician apart from the next. It's their willingness and their desire to be better. If you're only as good as the last thing that you learned, you're never getting better. So there has to be this driving force, this inner voice and desire that says, hey, I did good this time, but that's not all I'm capable of doing. And everything evolves, right? Like I'm almost 25 years into this and I'm still pushing the boundaries and trying to learn more and do things differently. And it's the evolution and the chase of finding better in different ways that I think makes a clinician grow and become better. And that's a big difference from someone who's doing the same old thing over and over again. So as I picked up a few more gray hairs in my career, I've been asked to give advice to the next generation coming up. And you know, as you've been around a long time, you see things, you hear things, you learn things, and you do things. And so my advice to the next crop that's coming through is this. Okay, number one, you have to know your outcome. If you don't know where you're headed, chances are you aren't going to get there, and you're allowed to change your mind. That's okay, but head with a specific focus in mind. Number two, there is no substitute for having good coaches and mentors in your life. The fastest way to get better at something is immersive learning. Be around people who are smarter than you, better than you, and more talented than you. You'll find that if you try to be the dumbest person in the room, you're going to grow a heck of a lot faster. Number three, this is not sexy. Discipline and consistency. Ordinary things done consistently over a long period of time yield extraordinary results. You gotta go in, roll up your sleeves, do the work. There's never a substitute for that. And the last thing that I like to tell people who are working hard and they're on the beginning part of their journey and they're trying to get better, raise your standards. If you can hold yourself to standards higher than anyone else possibly can, most of the time, things are gonna work out for you. Let me tell you about my ergonomics journey. So I started dental school at age 23. I didn't get my first pair of loupes until age 30. Then I got my first set of loupes because your vision starts to change. I'm like, oh, wow, I can see things better. But here's the thing is they put you with a low magnification and a really flat angle on it. That was the beginning of the end. Low magnification, a really flat down angle like this, and it forced me to start doing dentistry like this. Well, think about this from an ergonomic perspective. The second you drop your chin towards your chest, you're putting massive compression on C5 and C6. Trust me, when you're in your second decade of dentistry, you're not bulletproof anymore. That's where the aches and pains come. Now all of a sudden the soreness starts turning into pain. And then pretty soon you have arm pain, shoulder pain. So then what did I do is I switched to microscopes. And I was like, hey, this will be fantastic because I'm gonna have to be like a submarine captain doing dentistry now, looking like this. But the amount of time I was spending moving the scope and trying to move the patient's head and then get the thing back in focus, it was slowing me down big time. So then I went back to my loupes. And guess what happened with that? Then I had more pain coming back again. Until the best day of my ergonomic life happened. I learned about refractive loupes from Bryant Dental. And it changed my life. Because as soon as I saw about these loupes, I'm like, I gotta get a pair. And I reached out to you guys, and you're only in London. So what did I do? I hopped a plane and went to London. To me, it was a no-brainer. My health is on the line. You saw what your dental instructors looked like. They all looked like Quasimodo the Hunchback. And to me, that's a cautionary tale. If the solution's there, who's the dummy for not taking advantage of the solution? So I hopped a plane, I went to London, and Bryant Dental could not have been more fantastic. They came and met me, I got measured, and a short few weeks later, I got my first set of loupes. Now this is a funny story. I got my loupes, and I put them on for the first time, and I reached for my instrument, and I was reaching in the wrong direction, and it took me about a day to get used to the hand-eye coordination, and that's actually a common question that people will ask. They'll say, well, how do you relearn because your eyes are looking this way and your hand's going that way? It happens so fast. You retrain very quickly. Within a matter of weeks, the pain started going away. And now I work every day with my chin up and I don't have that neck pain. Every dental clinician at every level, give yourself the gift of posture and ergonomics and pain-free dentistry. Dentistry is the most ergonomically unfriendly profession that there is. We all know it. Bryant Dental has solved it. So not everyone has to be crazy like me to hop a plane and go to the other side of the world to get fitted for a pair of loupes. Bryant Dental's here in the US now, and thank goodness, because now you have local area reps who can take care of you, get you fitted for your loupes. The products that they're developing are fantastic. You know, it's not just the loupes, you know, the ergonomic stool, the Nomic is absolutely fantastic. It's really helped, you know, with my pelvic area and my back. I'm so much more comfortable. But yeah, take advantage of it. Find out who your local area rep is and they'll take great care of you. One of the reasons why I chose Bryant Dental, you know, you think about like who am I really partnering with here? Because it is a partnership. This product is taking care of you. And Bryant Dental not only was designed for dentists, but it was designed by dentists. These are the very people just like us who have suffered the same issues, had the same problems. They actually just stopped and took the time to help solve these problems for us. It's amazing if you think about it. Like, look, you put these things on right here, and the very thing that's saving my back and my neck is a little mirror inside of here. Bryant Dental did not invent the mirror, but let me tell you what they did do, is they figured out a genius and ergonomic way for it to help us do what we need to do. When you're getting precision loupes, you want to know that the fitment is going to be great. You want to have help getting it set up and aligned. And every time I have reached out to them with a question or asking, how do I maneuver this a little bit better to improve what it is that I'm doing? They are fast, they are responsive, they are kind. They really value the relationships that they're forming with their customers. And I think that's a lot to be said, that you can actually get someone on the phone instead of, you know, going to an automated voicemail box. You know, no one really likes that. They're really good people who are trying to do the right thing for our profession. To me, that means a lot. They're doing good things. So there's only two things I wanted to do with my whole life. It was either going to be a dentist or professional skateboarder. And fortunately, the way the cards fell, I actually got to do both. Professional dentist, amateur skateboarder, or as Bryant Dental liked to coin me, the skateboarding dentist. Check this out. They put the engraving on here. You know, usually people put like Dr. Marashi or something boring like that, but I get the cool skateboarding dentist. It's kind of an interesting blend of the art and science, right? Because cosmetic dentistry is creative and so is skateboarding, but also both require a lot of precision as well at the same time. So I'm really happy with it, and I dig being the skateboarding dentist. I've spent my life and my career in the pursuit of better. When you have the tools and instruments that allow you to do better, be better, and in this case, see better, you get to be better as a clinician. You're delivering a better result for your patients. The smiles look better. Everything comes into focus.